some of your questions that you have all been sending me and I have not been responding to in the last couple of months, but I am now. I am here and I'm going to be going through all of your questions and comments and answering them to the best of my ability. So I hope all of this helps. This next question comes from a user who says, I'm currently a medical assistant and today I went to look at a school and it looks like the best route for me is healthcare administration. I'm not sure if being a medical assistant is good to have for this degree, or if I should focus on getting a different entry-level job. Any advice is much appreciated. Thank you. So in this video, I'm going to talk about why it's good, why my medical assisting experience is actually good for a healthcare administration career. If that's what you really want, it works and it's great. Secondly, I will also go through some other potentially different routes if that's what you think you would be more interested in, because it does seem like this person and other people might be experiencing something similar to this. They feel like this degree program is really the only option to move forward in healthcare. So I'm assuming that's the real question here. Is this really my only option? I'm going to talk about why it's a good option, but also other options that you might want to consider, because you don't have to do that. You don't have to go to healthcare administration. So first up, let's get into why it's good. Why is it good that already being a medical assistant is a great foundation for healthcare administration? Well, it has already given you firsthand experience in how the actual healthcare system operates, right? You've had interfacing with patients, and you've also dealt with providers and everyone else on the back end. You've dealt with schedulers, you've dealt with whoever runs the business, right? So you have firsthand experience getting to know how the whole system works. So that's great. You know what patients deal with. You can feel for them. I'm sure you have empathy for them because you worked with them. But you also work with the providers, so you know what they're dealing with, and you've worked with administrators too, right? Now, those are pretty much the main interfaces that I'm sure you're getting when you are a medical assistant, right? I think that's really great, valuable insight for an administrative role in your future, because you understand the workflow, you understand the challenges from multiple different perspectives. Now, keep in mind, healthcare administration is going to be the business side of healthcare. So you would be working somewhere on the business end of healthcare. You're not going to be a provider where you interface with patients anymore. You're not going to be working with doctors. We'll probably interface with doctors here and there, but depending on where you work in healthcare administration, but for the most part, you're working on the business end. It's quite vast. It's so many different areas. There's a lot of different spaces you could be working in within healthcare administration. So maybe my advice would be to explore different areas of healthcare. And keep in mind, you would be working on the business end of that. So maybe marketing, scheduling, coordinating, the business side, not the side that interfaces with patients or customers, or you might not even be working directly with providers anymore, depending on where you work. So that's something to keep in mind. If that's something that still interests you, wonderful, cool. So, but if an administrative role seems like it's not really where you want to go, because in your question, it kind of seems like you feel like this is really it. If I want to move forward in life, if I want to move forward in healthcare, that's the only route that I have. And that is definitely not true. That's only one option. So I believe that the school that you visited, they gave that to you because they're like, this is probably the easiest thing for you to get into. And we definitely want to get you to go to our university or our school so they can make money off of you. Education is also a business. So sometimes you don't always want to ask those questions to the institution because they are incentivized to recruit you and get you into their programs. So what is actually right for you? That's something you have to decide for yourself. So yes, being a medical assistant is great for healthcare administration. You can do that, but like I said, think of it, do you think you want to work on the business end of healthcare? If you don't, then maybe that's not the degree for you. Let's look at some other potential career opportunities that might be in your way as well, because that's not the only way to make money in healthcare. And healthcare administrators they're not necessarily rich people. Unless you become a CEO of something, you're working a regular job. So it's decent money, but you're not going to be rich. So you may as well focus on a career that you're going to enjoy. So let's look into some other options. What are some other options that you could possibly do? If you like to interface more with patients, you want to take care of patients, or maybe you don't necessarily want to be invasive with patients anymore, you want to be more of an advocate or a consult, there are plenty of opportunities for you there. So you can be more of a patient advocate. You can help patients navigate the healthcare system. You can understand treatment plans. You can deal with insurance issues. Now, this would require some more certifications, but you don't necessarily have to go out and get a healthcare administration degree. Now, why is this a good fit? Well, you have clinical knowledge and experience with patients. So that makes you a good at explaining medical processes and advocating for patients' needs, right? Another option you can be a health coach. And if you're going to go down this route, you may as well be an entrepreneur. In which case, I would say you don't necessarily have to even go for a degree. You can, but you also don't have to. You have clinical skills and probably a really good ability to connect with patients, which would be really great for guiding and motivating patients, right? So you would be helping them achieve health goals, weight management, fitness, chronic health conditions, things like that. Now you might find that you do need more training, but healthcare administration is not going to give you that. That maybe you might want to look into health science or something like that, or other certification programs. You can also become a phlebotomist. Phlebotomists make decent money, all right? Especially depending on where you work. You can work for people, but in some ways, I don't even know if it's every state, but you can also go into business for yourself if you feel like you have an entrepreneur spirit. You can in some states, you can actually you can work with a physician and you can do IV hydration. You can have an IV hydration therapy business. You can do things like that. But for the most part, as a phlebotomist, you're going to be poking people. You draw blood for tests, transfusions, donations, things like that. So there's a lot you can do with that. You can get creative. You can own your own nonprofit clinic for blood donations and things like that. Or you can just work for somebody. Doesn't matter. You'll make decent money. And you're already trained in most of these clinical tasks anyways as a healthcare or as a medical assistant. So I think it would be easy for you to get the certification. And it would probably be easy, and you probably have an advantage because you're comfortable working with patients already. So you'd probably be a good phlebotomist if that interests you. You can do patient care coordinator, right? For something like this, you're probably going to have to get a certification. This may require certification or it may require a bit more experience. Maybe you start trying to, as a medical assistant, just start trying to get jobs that are more on the administrative side, play more of an administrative role in medical assisting jobs rather than something that interfaces with patients so much rather than a clinical role. Because if you can get more experience in an administrative role with your MA, that would give you a lot more experience, and you don't necessarily have to get a degree in healthcare administration. You can do things like becoming a patient coordinator. You can get more experience and you can be more of an office manager assistant in small clinics. Your experience is actually very, very valuable. So there are other things that you can do that you don't have to necessarily get that degree if you don't want to. Also, since you have a lot of experience on the clinical side, you can get additional certification to become a surgical technologist if you're interested in surgery and things like that. So what are you going to do? You're going to be assisting surgeries. You're going to be prepping the operating room. You're going to be sterilizing instruments and things like that. You're helping the surgery team. And you'll make decent money doing that as well. And look, like I said, it's just a certification program. You're not going years in school, spending tons of money in school. And that might be a lot of fun for you if you enjoy that kind of thing. And then eventually, maybe that would turn into something. You can also be a diagnostic technician. You can do ultrasound technician, EKG technician. And these are just going to be short certification programs. So you'll make decent money and you're going to do ultrasounds. Think about it. If you like babies and things like that, you can be an ultrasound technician that reads ultrasounds of pregnant women. You get to see the babies in the womb and what's going on. I think that'll be fun. But I'll make decent money doing it. And like I said, you don't have to do boring administrative stuff. But if you still want to interface with patients. A few more that you can do. You can do occupational physical therapy aid. That's another certification for you. You don't have to go to get a bachelor's degree. You don't have to go too far with your education on that one either. And you still get to interface with patients and make good money, right? Another thing that I would say, you can be a patient educator. And this probably goes, I've talked about similar job titles earlier in this video as well, but you're basically going to teach patients about how to manage their healthcare conditions. If you have chronic illnesses, you'll be there to say, hey, eat this, don't do this, right? Medication regimens, helping people, educate them on how to make sure they take their medications when they're supposed to, help people prepare for their procedures, things like that. As an MA, you probably already educate patients in your job, so this is something that you're already familiar with. So you can go down that road. You can also be more of a community health worker. So this is more about educating people as a community. You would be more of working for the city in this case, and probably host little interventions within the community, talking about preventative care, access to any type of services that maybe the county provides, or low income benefits and whatnot. So that kind of, you can go into that space. With this, your patient care experience would translate really well here because you're already used to educating patients and assisting them with healthcare needs, right? So this could also be a good option for you as well. So I hope this helps you make a little bit of an informed decision. Don't think that you have to become a healthcare administrator. You have to go get a bachelor's or a master's degree in healthcare administration just to move forward in healthcare. There are so many other ways you can work in healthcare. As a medical assistant, you've interfaced with patients, healthcare providers, you've interfaced with administrative roles, you know the whole gist of the healthcare system from your standpoint, you have good experience. I would just figure out exactly where I want to be and go in that direction. I think it's a matter of, do you want to work on the business end? Do you want an administrative role? Or do you want to work with patients? You just want to do more. You want to grow, expand. I think that's the question here. And keep in mind, either way you go, if you are more of an entrepreneur, you can go down that road as well. None of these would have you stuck in a job working for someone else if that's not what you want to do either. So I hope that helps. Keep the questions coming, people.